This is a frontal chest radiograph in an adult male patient, demonstrate multiple surgical clips in both sides of the mediastinum. And these surgical clips are likely to represent bilateral lung transplant. This patient has also got central line, which is a type of central line called as portacath, the tip of which is at the SVC, and there is no evidence of pneumothorax. These portacaths are used for long-term antibiotic therapy. I suspect this patient has got cystic fibrosis for which he has had a lung transplant, which requires long-term antibiotic therapy. In my routine practice, I would look for any evidence of previous radiographs for comparison. And looking at the previous radiograph, you can see bibasal bronchiectatic changes and coarse bronchovascular markings, which is not a normal finding in such young people. This patient has had a lung transplant for cystic fibrosis. These patients need to be monitored again in future for any evidence of development of cystic fibrotic changes in the lung transplant itself. Thank you.